Hi everybody and welcome to today's podcast. In this solo episode, I will be talking about what happens if you attend a breast clinic. If you have any breast symptoms, it is likely that you will be referred to see a breast surgeon, and not knowing what will happen can be a little bit scary and overwhelming. So I thought I'll give you an insight as to what can happen when you attend a clinic appointment. So let's get started. Firstly, I would suggest setting aside about an hour and a half to 2 hours of your time for your appointment. Sometimes clinics can be delayed, so I would suggest giving yourself enough time for this. So bring something to read or something to listen to, and maybe even somebody along for company. In the UK, it is likely that you will attend a OneStop breast clinic. This essentially means that everything is done all during one visit. These kinds of clinics are also known as rapid diagnostic clinics or same-day clinics. And here you will get what is called a triple assessment, which includes a physical examination, scans if necessary, and also biopsies if necessary. So all is done during one clinic visit, which of course saves time, but it also reduces the anxiety of having to return for multiple visits. So at the end of the day, you will leave with a diagnosis and explanation of the cause of your symptoms. If all is well, then you'll be discharged back to your referring doctor, so that will be your GP or family physician. However, if you've had a biopsy, then you'll be asked to return, usually within a week or 10 days for the results. So what happens when you see the doctor? Well, firstly, the doctor will ask about your symptoms. For example, how long you've had your lump for, whether it's changed recently, how long you've had your breast pain or the changes in your breast shape or skin. Whatever your symptoms are, the doctor will want to know about it in a little bit more detail. You will also be asked about your other medical history as well as your family history of breast cancer. Once the doctor has all that information, the next step will be the physical examination. For this, you will be asked to get undressed from the top half, including taking off your bra. Now, of course, if you're a man, then this will not apply to you. There should be a chaperone present, and you can always request for a chaperone during your examination if there isn't one there already. The doctor will then examine both of your breasts as well as your armpits. Now, if the doctor feels it is necessary for you to have scans, then you'll either have an ultrasound scan or mammogram or both. In the UK, mammograms are only done if you are over the age of 40, and this is because young people's breasts are quite dense, and it has been found that mammograms are not helpful in detecting cancers in the absence of any clinical or ultrasound scan detected lesions. So that means that if you are under 40 and a lump that is worrisome has been found, then you will likely to have a mammogram, but otherwise you won't. So if you have a lump, or if we see something on your scans, which is either a mammogram or your ultrasound scan, that we feel needs to be investigated further, then a biopsy will be performed, and this is usually done there and then. If a biopsy needs to be done under mammographic guidance, then occasionally you'll be asked to return to have this done on a separate day. The biopsy is done under local anesthetic, which is injected to numb the area and the skin surrounding it. Once this is done, using a biopsy needle, a sample of the lump or the area of concern is taken. Sometimes up to 3 or 4 samples are taken, and this is done to make sure that we get a good representative sample of the breast tissue. The whole procedure doesn't take very long, and it shouldn't be painful. The worst part of it is actually the injection of the local anesthetic. You will feel a sharp scratch of the needle and some stinging when the local anesthetic goes in. But after that, you shouldn't really feel any sharpness or pain. You will feel a bit of pushing and prodding, but that's about it. Once the specimens are taken, they will be then sent to the lab for analysis. As I mentioned before, you'll have to come back to the clinic in about a week to 10 days' time to get the results. So after you've had these scans taken, you will usually go back to see the doctor to discuss the results and go through them together. If all is fine, then you can leave the clinic knowing that your symptoms have been thoroughly investigated. You should be given appropriate advice and some written information to take home with you. So I hope this has been a helpful summary of what to expect when you come and attend a breast clinic. If you have found a lump or any new breast changes that you are not sure about, I would suggest you come to a clinic and get them checked out. A clinic visit isn't that scary. Of course, there are always anxieties attached to coming to a breast clinic, but we are here to help and to provide support and hopefully be able to allay your fears. If you'd like a recap of this episode, please feel free to visit the show notes at www.mybreastmyhealth.com/breast-clinic. Here you can find the transcript of this episode and you can download it for free if you want to. So thank you so much for listening. If you have found this episode useful, I'd be grateful if you could leave a review on iTunes. And what this does, it will make the podcast more discoverable and hopefully get found by more people who can benefit from it as well. If you would like to be notified of future episodes, please hit that subscribe button so that all the new episodes will be automatically downloaded to your podcasting app of choice.